Hi guys, my name is Joy. Welcome to my channel. I've been in the field of diabetes more than 20 years. My first video was all about good insulin injection technique. This video is all about mistakes I've seen over the years. What sort of mistakes? Let's look into one at a time. When you come to storage, insulin pen can be kept in the fridge. I mean spare insulin pens. I've seen several times insulins are kept in the freezer. Freezer is not the storage, fridge is the storage. Just remember that. But once you started taking out for your purpose, for your use, keep it in the room temperature. You do not have to put it back in the fridge. You can even keep it 28 days in the room temperature. That's fine. But some countries, you may have very hot weather, more than 30 degrees outside and inside the house. Your room temperature is more than 30. Yes, of course, you can keep it in the fridge. But just remember, you have to bring the pen outside at least an hour before your next injection. Otherwise, cold insulin can give you pain and bruises. There are several people are on premixed biphasic insulin, cloudy insulin, that contain two different insulins. You have to mix it before you inject. Don't get angry with your insulin. Don't vigorously shake. If you shake it vigorously, you get air bubbles inside. That will block your insulin flow. You may not get the correct dose of insulin. So gently shake it, as you seen in my first video. Once you mix it properly, then you have to prime it. I've seen people are holding pen downward position when they want to prime it. That's the wrong thing you're doing. You have to hold the pen upward position and squat it out. Why do you have to hold the pen upward position? Air bubbles come on top. If you've seen air bubbles at the sides, you just tap. Then you can get rid of it. The purpose of priming insulin pen mainly to test your insulin pen, test your needle, and you're trying to get rid of the air bubbles. That's a purpose. Before you inject each time, please prime it. I've seen people are using different types of longer needles. I've seen them using 6, 7, 8. Either use 4 or 5. That's the best needles you can use it. Shorter the needle, the better. Why? Because longer needles can get into your muscles. Insulin works completely differently in muscles. It works very faster. You do not want insulin causing hypos. If you inject it into your muscles, insulin can cause hypos. So please choose the right needle length, either 4 or 5. And also I've seen people are pinching their skin. If you're using 4 or 5 needle length, you do not have to pinch your skin. If you pinch by mistake, if you pinch your muscles, insulin goes into your muscles. You know the story, what happens when you inject insulin into your muscles. So size wise, either 4 millimeter or 5 millimeter is the correct length of needle you can choose. Once you finish injecting, you should discard that needles in the sharps bin. You do not want insulin needle causing needle prick injuries to your family members or even the bin collectors. Don't put it in the normal bin. One of my friend told me she is a patient. She's been on insulin for more than 30 years. When you come to insulin, she slows down. Everything, the whole world slows down for her. She check everything twice. Or even ask her husband to come and check it before she inject. In the secondary setting, hospital setting, two nurses are checking insulin before we administer. Same as we can apply that in the community. If you don't have anybody to check at home, use your modern technology cameras. Ask someone to check your insulin dose. As you know, insulin is a very potent drug. You do not want any harm caused by insulin. So make sure you are checking at least twice your dose before you inject. Don't get angry with your insulin. Insulin is a lifelong partner. Don't fight with your partner and come and inject your insulin. It can be a bit dangerous. I've seen people come into hospital with overdose of insulin. We do not want this overdose of insulin. Please take it easy with insulin. Thank you very much for watching this video. My next video will be all about insulin injection sites. Why we do have to rotate insulin injections? If you don't rotate, what will be the consequences? Thank you very much for watching. See you next time. Bye.